And here we are. So the rotator cuff and shoulder pain workshop. What we're going to be discussing over this next 45 minutes to an hour, you're going to be able to learn what the rotator cuff is, common causes of shoulder pain, and how to heal it naturally. We're going to be discussing how to help people get back to normal without unnecessary medications, injections, or surgery. It will be hosted by Professional Physical Therapy and Sports Medicine, and will be presented by myself. I am Gregory Patt, Doctor of Physical Therapy. Real brief, just a little bit about myself. I actually grew up in Bellingham, graduated from Bellingham High. My love and interest of physical therapy actually started at a young age. I was lucky in knowing that this is what I really wanted to do when I got older. I actually in elementary school had to go to physical therapy. And at that point, I remember being a really good experience. I really had a great therapist. It seemed more like fun and games, which now learning into it, that's what we try to do with the younger elementary school age kids. So I really enjoyed my time there. And then really going through high school, continuing with athletics, injuries off and on, rehabbing from that, and then taking anatomy classes in high school. I really kind of was always interested in the field. And so I went on to Quinnipiac University, which is down in Hamden, Connecticut. Beautiful campus down there if anybody's been down there. Really good hockey school as well, actually, now. And I graduated from Quinnipiac University in 2014 with my doctorate of physical therapy. And then I've always come back and started treating at this clinic. I've been here now since the early 2015. So about 5.5 years. Almost going to be 6 in the fall here. So in that time, I've also become certified what they call an OMT, which is an orthopedic manual therapist. And what that really means is I use my hands, so manual, using my hands to mobilize and move the joints around the entire body to increase mobility, decrease pain. So one thing we'll talk about, what we focus on a lot at this clinic, is good manual therapy. So I did that earlier this year. It's a multi-year process in order to get that certification. And then last year I went and became certified in a technique known as dry needling. Dry needling, what it is it uses, if anybody's ever heard of it or not heard of it, uses a very thin needle, similar to an acupuncture needle, but the reason why you're doing it is much different than acupuncture. But if you think you're an acupuncture muscle, but we use it to put into tight knots in muscles to get that muscle to release. Again, the goal behind that is to increase mobility, decrease pain, and again, the name of the game, getting people back to normal without any necessarily injection, surgery, or anything like that. So we've had really good results with that as well. But I'd love to get to know, I know a couple people have emailed in kind of what's going on. I know I saw an email from Kathleen. I just mentioned I saw an email from Laura too. But I'm going to load the chat window back up here. If you guys wouldn't mind, just again, you don't necessarily have to put your first name because a lot of you guys are logged in with your name. But briefly, just want to kind of give me the very short abbreviated version and kind of what's going on with your shoulder. Again, Kathleen, I know we talked about playing the violin, having that pain. Laura, the sleeping, very common. If anybody else has anything, Ramon, if you have anything in particular that's going on with your shoulder or something you want us to focus on or myself to focus on, you can leave it in this chat kind of as we go on. So I'll give everybody a minute just to see if they have anything, if you guys are typing. Yes, after the yard work, I saw that email. Very common this time of year, in the spring and now, doing a lot of yard work. Problem with yard work, and I know Dean mentioned it, it's not leaf blowing season, thank God, right now, but any yard work is a lot of repetitive motion, whether you're bending down, pulling weeds, you are blowing leaves, or you're raking, or anything like that, working in the garden, a lot of repetitive motions. Good. Yep, lifting the arms, again, very, very common. Good. Panty, reaching up high, or for the seatbelt, again, very common. Either it can be your right arm reaching across to grab the seatbelt, or your left arm trying to reach the seatbelt up in there. So again, thanks for chiming in, kind of briefly describing what's going on with your guys' shoulders. And what I'm going to do, I'm going to kind of move on here to the next part. So who is professional physical therapy and sports medicine? Why are we all here tonight? Sam sleeping. Yep, we're going to talk about that as well too. But professional physical therapy and sports medicine, we have been in Franklin now since 1992. We started, if anybody's familiar with the Franklin area, we started off right in the Stop and Shop Plaza, right off of exit 17 off of 495. We started there in 1992 in that plaza, and we didn't move far, but we are now directly located across the street from the Stop and Shop Plaza, right off of exit 17. We have been in this building now since 2003. So we're the building right next to the new Starbucks building. Over that time, we are getting closer and closer each time I do his workshop to 300,000 total visits. So a lot of visits. And the vast majority of those, I would say, are shoulder pain related. I would say shoulder pain and back pain are probably the most common things that we see. So we started doing these workshops, and we've been doing this workshop now for 4 years. And again, it's probably going to be about 5 years come this fall. So we're doing these free workshops. We've been doing the shoulder one. We've done a back one as well. We've also done one about arthritis. And the reason why we do these is you just hear a lot of terminology from different doctors, and now the Dr. Google that a lot of people use. You hear these terms, you see these things, and you sometimes can think the worst, or you don't really have the best understanding, or go see an orthopedic doctor. They say, yep, you have shoulder impingement. Yep. And then they walk out and you don't know what that means. What does it look like? Does that mean I need surgery? So we started doing these workshops. Hopefully at the end, everybody has a little bit better understanding. One, on just basic kind of anatomy in the shoulder, how it works, what it looks like, how it's designed, what are the good things, what are the bad things about the shoulder. And then what is a rotator cuff, and what are these issues that can happen, and how can they be corrected without injections, surgery, or anything like that. At the end of these workshops too, as kind of a community service and outreach, some things if you guys want to think about as well, is we do offer free consultations. So at the end of this, if what we talk about seems like it kind of describes the symptoms that you're feeling, and you've been dealing with the shoulder pain and you want to kind of get back to normal, we can certainly help. We'll kind of talk about how to go through that process. But enough about us. So if everybody has that sheet that was emailed to you titled Shoulder and Rotator Cuff Workshop, we already did number 2, who was professional physical therapy. So we got all that stuff out of the way. So you don't need to hear us talk about us anymore. We're going to go back up to number 1. What is the rotator cuff? So the rotator cuff, it's a group of 4 muscles that attach to your shoulder blade and your arm. And their job is to help move your arm. Very simply, that's what it is. And then what is the shoulder? The shoulder is a ball and socket joint, and it's the most mobile joint we have in the body. So I am going to stop the share for a second, and I'm going to load myself up to the big screen here. And what I want to show you guys is the shoulder. So this would be your right shoulder. This would be looking straight into the front. So you have your arm bone there. It's also known as your humerus. You have your shoulder blade, your kind of chicken wing back here, called your scapula. And then you have your collarbone that kind of comes across the front, also known as your clavicle. So you have really these 3 bones make up the shoulder joint. The shoulder, what we talk about, is it's a good joint and it's a bad joint. Good, it's the most mobile joint we have in the body. You can move, ideally, or maybe have some pain reaching up overhead, but ideally we can move the arm all multitude of directions. You think about your knee goes up and it goes down. That's pretty much it. The shoulder you can move, it's the most mobile joint we have in the body. One thing we talked about in the slideshow is it's It's what's called a ball and socket joint. So you have the ball, that's your, think of it like a golf ball. And then you have the tee. You can see on the inside there, that little tee. See, this golf ball is much bigger than that tee. So if you had a golf ball and you tipped it on its side, that golf ball would likely fall off the tee. So the bad thing about the shoulder is it's the most dislocated joint we have in the body. We're not going to focus too much on shoulder dislocations or anything like that, but if that's something you've experienced or have questions on, certainly post them to the chat, send me an email. I'd be happy to go through with that. It's something we see very frequently as well too. Again, it's the most dislocated joint we have in the body. Structurally, again, it's designed to move. It's not designed to be a very stable joint. So one of the main functions of the rotator cuff, so you have 4 rotator cuff muscles. This kind of tannish color right here, these are all showing you ligaments around the shoulder in there. But if you think of those as your rotator cuff, one rotator cuff muscle is on the inside of your shoulder blade, and then the tendon kind of comes across in the front like that. There's that one. In the back, the muscle will be all along the back side of your shoulder blade. It kind of, then the tendon kind of comes across and inserts down onto the arm. You have another one that kind of comes similar angle up like that. And then you have one that kind of comes right over the top of the shoulder blade underneath, and the tendon attaches down to the arm there, kind of across and into the top right in there. So one of the major functions of the rotator cuff is you can almost see it kind of forms like a circle all the way around that golf ball. And its function is to pull and hold that golf ball in place, so to provide that stability till the arm can move around without leading to any pain or limitations. So that's kind of what the shoulder looks like anatomically. I'm going to load back up to the slideshow here. And so, again, it's the most mobile joint we have in the body. There's a lot of structures that need to move properly in order to get that full mobility. There are 4 areas that really have to work together. The first one is the neck. So we're going to focus a lot on the neck later on in a few slides. And I know some of you talking about sleeping, so side sleepers, stomach sleepers. People talk on the phone like this, or looking down, or maybe playing a violin, turning your head or tilting your head. A lot of times there could be an issue with the neck. And if the neck isn't working properly, all the nerves that control the shoulder, they come from the neck. So if there's any issue with the neck, that's going to affect the shoulder. So that's the first thing we look at. And again, we're going to come back to the neck later on and go through in much more detail. We also have the collarbone. Again, collarbone is that clavicle that kind of comes right across the front. As you raise your arm up all the way overhead, that clavicle has to be able to rotate a little bit. That clavicle isn't rotating, you're not going to be able to get full mobility. You're going to lead to compensations elsewhere, and it's going to lead to shoulder problems, likely shoulder pain and discomfort. You also have the shoulder blade. Again, if you remember back on that model a couple minutes ago showing you the rotator cuff muscles, they all originate on that shoulder blade. So you can just imagine just right there how important that shoulder blade is. And that shoulder blade has to rotate and move to allow that full mobility. So very important. And then finally, there's the rib cage. So a lot of times you think of the ribs kind of down, supporting your lungs, but your first rib actually comes up in this space right up here, right above your collarbone. So a lot of people are kind of surprised, but your first rib is actually, way up here. And I'm going to show you guys a test later on you can do to determine to see if you have any problem with that first rib or the neck. We're going to talk about that later on, so certainly stay tuned for that. So again, that's number one. What is the rotator cuff? Again, there's these 4 areas that have to work together for shoulder movement. Again, like it's the most mobile joint we have in the body. It takes a lot to keep that joint moving. And when it's not moving, pain comes fast, and it's a very painful and sensitive structure that can affect a lot of things during the day. So one of the first things that a physical therapist is going to do is they are going to determine, is your pain reproducible? And we wrote on the sheet there in the last week, what's the worst pain you've had? If you guys want to fill out a number, 0 to 10, the worst pain that you've experienced in your shoulder, 0 being no pain, 10 being emergency room pain. If you guys want to take a second to do that. But what we do is, when we're as a physical therapist, we want to kind of see, is that pain reproducible? So I want to kind of load back up the chat window here, if it's going to allow me to. I'm going to have to stop my share for a second, but I want everybody to kind of, we've already gone through some. So we have sleeping, we have reaching up high, reaching for the seatbelt. We have yard work. Kathleen mentioned yard work. Ramon had mentioned lifting his arms overhead. And I know Lisa, sorry, not Lisa, Laura, mentioned sleeping, and sleeping really bothering her again. So again, all those activities, they can create shoulder pain. Again, reaching overhead, lifting, reaching behind your back, getting dressed, either a guy putting a belt on, women putting a bra on, taking a bra off, usually very painful when you have a shoulder problem. So what we do is we look for all these certain activities to see if that pain is reproducible. So if every time you sleep on your shoulder, or you reach behind your back, or you reach overhead, that shoulder pain is present, that means that there is some kind of cause. There is something that is reproducing that pain. And that's a good thing that we look for as physical therapists, because 90% of people that come into physical therapy that have this reproducible pain, a certain motion or activity that reproduces their pain, if that is true, then if that pain is reproducible, drum roll, then that means there's a cause, and there we hold, that reproducible pain is now reducible. And again, that's the goal for physical therapy. Find out what activities are reproducing your pain, work with you, and then be able to reduce that pain and get you back to normal. Again, there's a small subset, maybe up to 10% or so people that may have shoulder pain, and nothing makes it better, nothing makes it worse. There's no activities, it doesn't have any rhyme or reason. There's people that come in with those situations, and a physical therapist has to be able to determine who needs to be referred out and who should they be referred to kind of figure out how to get them feeling normal again, whether it's physical therapy or whether it's seeing a doctor, getting more imaging or anything like that. A physical therapist is going to be able to look at. But before I go on to the next slide, because so many people talk about sleeping, I'm going to kind of stop myself for a second, briefly talk about sleeping, and talk about what I think is the best position to sleep in. I will tell you, sleeping is the biggest complaint we get with shoulder pain. It's always sleeping. If you ever know anybody that had a rotator cuff repair surgery, they usually sleep in a recliner for up to 6 weeks. It's just painful laying down. They can't move. And then when you are asleep, you can't really control your body. Your body just kind of falls into your natural kind of tendencies. But that being said, the best position to sleep in is what I like, is laying on your back. I like to put a towel or a pillow underneath each arm, especially the arm that's bothersome, to keep that arm in a little bit more neutral position. What happens is my computer almost wanted to restart. As the arm kind of comes down, that shoulder can come forward, and that can cause a little bit of compression and some irritation in the front there. So I like to put a pillow underneath each arm. I honestly, more back pain, but I like to put a pillow underneath the knees to kind of rotate the pelvis a little bit, take some pressure off the low back. Don't worry about that if you don't have to, but I do think that helps as well. And then what I also like to do is I like to take a towel, small towel roll like this, when you're laying on your back, and just put it behind your neck, just to support that natural curve in your neck a little bit better. Sometimes what I have people do is stick a towel roll like this inside their pillowcase so it doesn't move around so much, and then lay on there. So the best position, on your back, towel roll underneath your neck. Again, so many times the neck is a problem with the shoulder. It's good to keep that neck in a neutral position. And then pillow underneath each arm. The worst sleeping position is really if the shoulder's inflamed and aggravated, sleeping on the shoulder. But worse than that, the worst two positions are sleeping with your arm up underneath your pillow or something like that, or sleeping on your stomach with your arm up like that, or even on your back with your arm up over your head like that. those are the worst sleeping positions that are there. Again, it's sometimes hard to prevent yourself from rolling over or bringing your arm up overhead. You keep doing it. But I'll tell you right now, I mean, we have had people that we've taught them how to physically take a bed sheet or a towel and tie their arm down so they don't wake up with their arm up over their head like that where they're sleeping. Sometimes you just got to tie the arm down. If when you fall asleep, it does what it wants to do. But again, that's the first thing a physical therapist is going to do. That's number 3 on the worksheet is we want to figure out, is that pain reproducible? And then is that pain therefore reducible? So moving on, we're going to go back to the sheet here. So if I lost anybody go to get dinner or anything like that, bring it back to the computer. We're going to be going through the most common causes of shoulder pain. Number 1 is going to be a problem in the neck. So if anybody, I'll give you a minute to come back to the monitor here to make sure you're paying attention to this. So again, the first one is a problem in the neck. The best way to describe this is, we talked about working in the garden earlier. Think you're working in the garden, you're watering your flowers, all of a sudden you lose water pressure in your hose. What's the first thing that you do? You look back up and see if there's any kind of kink in the hose or anything causing pressure on it. And that's why it's not working. You want to do the same thing with the shoulder. Again, all the nerves that control the shoulder and the muscles in the shoulder and the rotator cuff, they all come from the neck. So if you talk on the phone like this, or you're a side sleeper, or you do play the violin, Kathleen, and you're not a violin expert, you'll know more than me, but if your head is turned or your head is tilted one day, or you're looking down, reading notes a lot, that can create a problem in the neck that can affect the shoulder. We know people oftentimes over the age of 50, if they had an x-ray or an MRI, the majority of them would show signs of some degenerative changes, some arthritis in the neck. So that kind of can close down the hole where that nerve travels, and that can be an issue. So the first thing you have to do as a physical therapist, if somebody's coming in with shoulder pain, or they've kind of pain back in here that they think is their shoulder, you really have to determine, is that problem really coming from the neck? Again, we see a lot of people who have gone to other PT practices, gone to other professions for the shoulder pain, and it hasn't worked. They've tried everything. And really, when they've come to us, we found that although you may have the pain here, the real issue is coming from the neck. And we'll talk about what happens with the garden hose. I'll bring back that analogy later on. But that's the first thing. You really have to assess the neck. And a lot of people have problems in the neck that affects their shoulder. And you can have a problem with both. You can have a problem in your neck and you can have a problem in your shoulder. And treating one isn't going to fix the other. And you need to really work on both at the same time. And that's something else that a physical therapist, what we do during those free consultations, and figure out, is it your neck? Is it your shoulder? Is it neither? Is it what is going on? And figure out what the best plan of action for you would be, so you're not wasting your time on treatments that aren't effective. So I mentioned earlier, there's a quick test you can do to see if you have a problem in the neck or the first rib. So what I want everybody to do is sit up nice and tall. And then let's just say this is my good shoulder, my uninvolved shoulder, and this shoulder is my painful shoulder or my involved shoulder. So whatever side is your good side, let's all turn our heads towards our good side as far as we can. See how far we can turn our neck. See if we have any pain, any limitation. Does it create any shoulder pain or anything like that? And then we're going to come back straight forward. And then I want you to all turn towards your painful shoulder. Ramon, if you have both shoulders are painful, you may have a little bit of difficulty, but if you feel like you're limited or you get tight or there's any kind of, you just can't turn your head as far, that's likely a problem in that first rib blocking that motion, or it could be a problem in the neck, or both. So again, that's a quick test you can do right now to see if you're having shoulder pain, but you also are limited towards that side of your shoulder. There's very likely something else going on in the neck or that first rib along with the shoulder, or there could be a problem in just the neck or the first rib area. So I am going to quickly stop the share because I just see a couple questions coming through the chat box that I'm not able to access without stopping the share. So before I go on to the next one, I'm going to stop this. See a couple questions. Good, I have a traction pillow. Good. Perfect. So I can go through this now. I got a question about a traction pillow. Traction pillow, that should work. You shouldn't necessarily need a towel roll as well. There's different types of traction pillows, so I would have to kind of see exactly what kind of type it is to make sure, but you should be able to do it without a towel roll. And is there any way to sleep on your side without you keep the shoulder in the right position? So the best thing to do is, if this is your painful shoulder and you want to sleep on your side, if you kind of roll a little bit so you're laying more on your shoulder blade, that's really the only way you can do it, sleep on that side. If you're sleeping on your good side, you just want to make sure your arm's kind of up by your side, because if your arm comes forward like this, that can cause a lot of shoulder pain. If it falls down behind you, that can cause a lot of stretch or shoulder pain as well. So a pillow between your arm and your stomach, that's a good thing to do to keep that arm in a little bit better position. I hope that helps. And then Kathleen asks, is a neck pillow a good idea to use? I do like neck pillows. I sometimes think they're a little bit too bulky. They're almost made more for kind of sitting on an airplane or something like that. That kind of holds you up a little bit higher to take some pressure off when you're laying down. I like to use a small or just a simple towel roll just to give you a little bit of support, just to keep that natural curve. I find neck pillows, they almost just kind of support the neck when you're more in a sitting position. But laying down, I think it works better to use just a towel roll. But I want to come back to the screen here. Moving on to the second common cause is impingement. So a lot of people have been told by a doctor or somebody that they have what's called impingement. So what does that mean? What does it look like? Why is it so painful? What structure is being pinched? We're going to cover all that in the next couple minutes. I'm going to go through this slide, the next slide, and then I'm going to bring back the model so you guys can see a little bit more clear. And it's going to make a lot more sense once you kind of see on the model how it's happening. But I'm going to describe this little schematic drawing here. So again, you have your shoulder blade, known as your scapula. Right there. You have your arm bone or your humerus. This, the acromion, there's no test at the end of this, but you can learn a fancy word. It's called the acromion. Acromion is the very kind of end in the top of the shoulder blade or the scapula. So what happens with impingement is there are structures that are being pinched between the humerus and the acromion. So kind of on top of the humerus or the arm bone and underneath that acromion, there's structures that are being pinched. So oftentimes it looks like somebody will go to reach up and they'll get pain kind of right around this 90-degree angle here. So it'll be okay down here. They go to reach up, they'll get pain, and then sometimes it'll almost ease up as they go. Sometimes they'll feel a click or any kind of pain, but it's usually right there they get that pain. And so what way you can kind of see if you have any kind of sort of impingement is, I'm going to go off to the side, but if you raise your arm up with your thumb up, and then if you raise your arm with your thumb down, you can't go as far because you're almost creating some impingement in that arm. So when you are reaching for things, you want to make sure you're reaching thumb up. You don't want to reach for something like this or reach into the back seat. That's why that causes so many problems. And impingement is really more common in males, actually, between the ages of 35 and 55, but it's not by much. It's very common in females as well. Usually you'll have that pain again, reaching over to the side. You can carry a bundle of firewood across your forearm with your arms down, but you go to reach a coffee cup or reach for the radio or try to drive in this position and you get that pain in the shoulder. That's that impingement. Reaching behind your back when you're getting dressed. All these things are kind of classified and very classic signs of that impingement. So this red here that's shown on the drawing, what does that mean? What is going on? They're kind of showing you that there's inflammation between those two bones. So impingement can come from, there's different structures that can become inflamed and create that impingement. So moving to the next slide here, conditions with inflammation, there's really 3 that I'm going to list. 2 of which directly kind of relate to impingement. The second one I just kind of, it goes on the inflammation idea, so I added it in, but it's not directly related to impingement. But if you look at this drawing, a lot of stuff you don't need to worry about, but you can kind of see the outline here. I'll try to draw with the mouse of the arm bone. That's your humerus. Here is the scapula underneath. This is showing you kind of the collarbone coming across. This area right here, this is that acromion. So the acromien's here and the arm bone is right underneath. And then the red here is showing you the muscles. So the muscles come across, just like I showed you. It comes underneath that bone, underneath this blue blob. You can see the white kind of striations. That's that tendon attaching down to the arm. So if it's that tendon that's being pinched between the arm bone and the acromion, you're going to develop a tendinitis, which is an inflammation of that tendon. Anytime you see the word itis, you know you're talking about inflammation. So again, that tendinitis, if you continue to rub and aggravate that area, that could lead to a partial tear. That inflammation could lead to a bone spur development on the underneath side of that acromion or the end of the scapula. That could end up leading to a complete tear. So again, if you have a symptom like this, you want to be checked out by a physical therapist to make sure matters aren't getting worse. You don't have a tear in the rotator cuff. So if it's a tendon that's inflamed, it's a tendinitis. If it's the bursa here in the blue, that's showing you the bursa. If that's inflamed, that's called a bursitis. Again, anytime you see itis, you know you're talking about inflammation. Then the third one, again, not directly related to impingement, but I feel like I had to add it in, and it goes with the inflammation. It goes with that itis theme. It's called adhesive capsulitis, aka frozen shoulder. It's kind of what we call it. So frozen shoulder occurs when that entire capsule or area surrounding the shoulder becomes stiff, thick, inflamed. They can't move their arm. I can't move their arm. It just doesn't want to move. There's a very classic pattern that it kind of freezes up in that can be recognized by a physical therapist. But again, it's that entire shoulder capsule area becomes inflamed. So I am going to, again, stop the share. Hopefully this makes a little bit more sense with the arm here. You have the arm bone just like that. You have the humerus again, shoulder blade, the scapula, and the clavicle. So what happens normally, the rotator cuff again is performing that kind of suction, holding that golf ball on the tee. And before I get into that, you can see the back of the shoulder blade kind of comes across. This bone right here, that's that acromion. So where the structures are being pinched underneath here and on top of here. So normally what happens is the rotator cuff and everything stabilizes it, stays right in the middle, and you rotate your arm up, and you have no issues, you have full mobility, everything is perfect. Impingement happens is when you get to this 90-degree mark, that we'll say this, let's just call this the tendon just for convenience sake. That comes up and you get that impingement. So you come up, you get that pain, 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 and then sometimes it'll click, and then you get past it, and when you come down, you get that pain again. So that rubbing, that leads to that tendinitis. So when you're reaching in this position, when you're reaching or anything like that, you're seeing that tendon is getting pinched underneath that acromion and on top of the arm bone there. So again, that could lead to a partial tear, could lead to a full tear if it's not something that's handled. So that's if the tendon is being pinched. The bursa sits on top of the tendon in there. So as the arm goes, same mechanism, it can still be pinched and kind of aggravated. And a physical therapist is going to have to determine which of the two. Is it more of a tendinitis? Is it more of a bursitis? What is really going on? So that's what impingement really is. So Ideally, the arm rotates up. It's good, impingement. When an arm, that tendon gets pinched. It doesn't have to necessarily be this one. It can be either of the ones that kind of travel underneath that bone in there. So I'm going to come back to the share here. Hope that makes more sense. So again, that's what impingement looks like on the model and kind of on these schematics here as well. And then finally, letter C on number 4, the most common cause of shoulder pain is poor posture. So real quick test everybody can do is sitting up nice and tall, raise your arms up as high as you can. You should have good mobility. You don't have a shoulder problem. And then if you slouch forward and you raise up, you can't get your arms up as high anymore because you've closed down that space, almost kind of created a position of impingement, but it's not because anything's necessarily wrong on the shoulder. It's because you now have poor posture. So again, one of the most common things we do see creating shoulder pain is poor posture that closes down that space. Nowadays, it's been more prevalent than ever. We're seeing people that are working from home, working at their dining room table, the kitchen table, in their bed, on their couch, hunched over a keyboard, really not able to keep that neutral, good spine like this person is showing you in the figure on the right here. So we're seeing a lot of posture problems now creating shoulder pain. So there was one study when I was putting together this workshop here that really highlighted this point perfectly. So what they did is they took a group of people and they gave them all an ultrasound, a diagnostic ultrasound, and divided them into those with rotator cuff tears and those without rotator cuff tears, of all even average age groups. And what they found is people with posture like this girl on the right, 2.9% of them had rotator cuff tears. Those of which had a posture like this girl on the left, 65.8% had rotator cuff tears. So big difference. You can see almost a 22% increase, higher percentage chance of a rotator cuff tear based on percentage alone. You walked into a room with 100 people that look like the girl on the right, maybe 3 of them have rotator cuff tears. You walk into a room of 100 people looking like this girl, I guess almost 66%, 65% are going to have rotator cuff, or 66 people. So you can see a lot of what we do is focus on posture. My favorite postural exercises, I'll show you this right now too, a little freebie. What it is really trying to get your shoulders back, trying to pinch your chicken wing, your shoulder blades together. I like to hold that 10 seconds. I usually have people doing it 10 times and have them do that throughout their day when they're sitting. It's going to help the neck and the posture. If your head comes really forward, you're going to get a lot of problems. So what you do is kind of tuck the chin straight back. Again, try to hold it 10 seconds. If you feel like you're giving yourself multiple chins, fortunately, that means you're doing it right. You're not looking up, you're not looking down, you're bringing the chin straight back. Those 2 are my favorite posture exercises. Everybody that comes in with a postural position like this lady here, I start them off with those exercises right away. So if you feel like you're at home right now and you feel like you're slouching, do those exercises and you may start feeling better right away. So that's what we want to talk about with poor posture. So again, there are other common causes of shoulder pain. Those are really kind of the top 3. And so again, you have impingement, you have a problem with the neck that needs to be cleared, and then you have to make sure your posture isn't contributing to or causing your shoulder pain. Again, really strengthening up the muscles in the back, stretching out the muscles in the front. You spend a lot of time sitting, playing musical instruments, sitting for long periods of time. You really want to make sure that you're really working and focusing on your posture to open up that space. So, after the common causes, moving on to number 5 on the worksheet. What does successful treatment look like? It's really a multifaceted approach, starting with a thorough examination to determine the cause. We do part of this at that free consultation that everybody will be offered at the end of this. What we do is we're going to figure out what is the cause, figure out what the best plan of action is for you. If you have been told you have impingement, or we think you have impingement, is it more of a bursitis, do we think? Is it more of a tendonitis? Really figuring out what is going on. If we think it's really something going on in the neck, you have to figure that out first. So that's the first step, is figuring out what's going on. Again, same thing on that garden hose analogy. If you're watering your flowers and the water pressure dies down and you start working on you think it's the nozzle, think the nozzle is your shoulder, the nozzle's the problem, you fix the nozzle, you buy a new nozzle, everything's with the nozzle. You can do anything you want to that nozzle, it's not going to start working if the problem was a kink in the hose or a problem in the neck. So you really have to go through a thorough examination to determine what's going on, what is the cause. Secondly, hands-on PT to move the shoulder and the surrounding joints. Again, you want to be able to use, again, we talked about that orthopedic manual certification that we have. There's actually about almost more than 50% of our staff actually has that same certification. We focus a lot on hands-on PT. If your shoulder blade or one of those areas, the neck, collarbone, first rib, shoulder blade, the actual shoulder itself, if one of those areas isn't moving properly, manually, we need to get that moving properly to improve the mobility, decrease your pain, and then following that up with stretching and strengthening exercises to retrain that muscle memory. Say you come in, you have impingement, the arm just gets so painful right there when you're reaching up to the side. And say we determine that it's really, I think it's a problem with your first rib. So we go and we do some manual therapy on that first rib. After that first day, you're really able to get up and you, wow, I noticed a big difference. That's where you really have to go home. We'll give you exercises to stretch, exercises to strengthen. You want to retrain that so those muscles don't start to tighten up and that first rib doesn't start to tighten up again as well. Then oftentimes we use modalities. The best modality that is really on the market and is really unique to professional physical therapy here is what's called the Class 4 laser. Laser used to be used by veterinarians forever. In human population, it's been approved since like 2007, 2008. It's usually reserved for professional athletes, D1 colleges, Olympic training grounds. You go into the Patriots locker room, I know they have one. Very popular there, but in an outpatient practice like this, not really common at all. We're one of the only ones in the area, one of the only ones in the state that have one of these Class 4 laser. So what it does is it uses light energy to accelerate that healing process. Helps decrease inflammation, decrease pain, increase mobility. We've been using it since 2017. We've had some fantastic results. It's worked well for people that nothing else has worked for in the past. They've tried this and it's really been able to kind of kickstart what's going on, and it's really helped a lot of people. So again, I mentioned Class 4 laser because there are different classes of laser. The Class 4 laser is one of the most powerful lasers that you can use without being a surgical laser or anything like that you can use for physical therapy. So it's all based on power, and anybody that's ever watched Home Improvement, they all know more power is always a good thing. You got to get the most powerful machine, and that's what we went and got. There's different classes. We went with the most powerful class we could get to really accelerate that healing process faster, get people out of pain faster. So I add in this slide just to make sure people are still paying attention. You didn't eat dinner at 6 o'clock and now in a food coma. But honestly, the lasers worked fantastic. It is more powerful than a Class 3 laser or something like that, but that more power equates to more pain relief and faster healing times. So if you have more questions about that, we'd be more than happy to set you up for a trial and things like that of the laser. But moving on, number 6, 3 ways to handle the pain. First thing is you can ignore it. We kind of all do that at first. We wake up one morning, we slept on our shoulder wrong, we have some pain, we kind of ignore it, hope it'll go away. A lot of times it doesn't go away, and then you end up watching a rotator cuff workshop at 6:30 on a Thursday night because the shoulder pain is not going away. So the first thing a lot of times is we ignore it. Then oftentimes we try to alter it, whether we take pain medicine, whether we get injections. People ask me all the time. I had this question actually today. Somebody who had an injection in their shoulder, and they always ask, how long does it last? And the question to that really is, it really kind of depends if the problem is fixed, why that inflammation was there in the first place. So coming back to the model, I'm going to bring back up the screen one more time here. So what happens, again, say you have impingement, you develop tendonitis in the arm, and say that's because your shoulder blade is not moving with the arm. So normally the shoulder blade moves, it could bring the arm all the way up. It's not moving, so you're just getting jammed up and you're pinching, and eventually you get all inflamed by rubbing on that tendon. You go see an orthopedic or your doctor, and they usually come in the back. They think it's a tendonitis. They'll give you an injection that relieves that inflammation. You walk out of there feeling good. You feel good. But if you still go back to the shoulder blade not moving, that inflammation is going to start to gradually build back up, and that injection would have worn off or not worked. But really, you never really fixed the problem. So what happens is, as the arm rotates up, shoulder blade has to move. So say you had a lot of pain, you went to the orthopedic, you had an injection, and then you come start physical therapy, and we can find out that it's really the shoulder blade that's causing that impingement in the tendonitis. So we work on the mobility of the shoulder blade, the injection, you get back, you're not creating any rubbing, any irritation, you're able to get back to normal, and that injection could last you forever because you really fixed the problem of what was causing that shoulder pain in the first place. So I just wanted to kind of show you that. That's what happens. People ask me about injections all the time. And then finally, you want to really be able to handle it. Again, I joked around. I think that's why everybody's kind of tuned in here tonight, because they want to kind of figure out the best options they have to handle that pain. And that's why we really offer those free consultations to kind of figure out what's the best opportunity to handle specifically your pain and what's going on. So I had somebody a little while ago, not too long ago, he had gone to the doctor, he had an MRI, he was actually scheduled for surgery. He was found to have a full thickness, a complete rotator cuff tear. And then they were scheduled for surgeries. Orthopedic said he needed surgery. His wife had been one of my patients in the past. And she said, well, why don't you go see Dr. Patt? Worst comes to worst, you can help using a lot of pain. You can help decrease the pain level, and it'll get you feeling a little bit better leading up to surgery to kind of better your outcome after surgery. So I met with him. I was talking to him. And the first thing right away, what happened was he'd go to turn his neck towards the side of his painful shoulder, and he could barely turn his neck. The other side, it looked good. Towards the side of his shoulder, barely move. So right away, I knew there's more than just a shoulder that's going on here. So after a little bit further diving and a little bit further examination, I was able to find that he did have a problem with the first rib. He also had a problem with the neck, and we knew that there was a problem with the shoulder. So we ended up treating all of those areas for around 8 weeks or so. And first day he came in, he could really only lift to here. By the end, he had near full mobility, ended up canceling his surgery, and was able to kind of get back to his prior level of function. So does it happen with everybody? No, but it can happen. And there's a lot of people that have rotator cuff tears that don't even know they have rotator cuff tears. And a lot of people that have them can go on and live normal, healthy life and be able to not have any limitations with their shoulder. But again, a physical therapist is going to have to determine that, help you kind of go through that process and see if it's something that you need to have surgery or that there's something that can be fixed. So again, going back to what to do next, I know talking with you guys, with Laura, with Kathleen, figuring out kind of how to help deal with your shoulder pain, I would highly recommend signing up. You can either talk to Ashley you can call the number at the bottom of the screen, or you can go to our website at proptinc.com for a free consultation. Again, what that is, it's about a 15, 20-minute consultation, absolutely free. And what we'll do is we'll figure out the best course of action for you, figure out what's going on. Is it your neck? Is it your shoulder? Is it bursitis, tendonitis? What's going on? How are we going to fix it to kind of get you out of pain sooner rather than later? We're all able to kind of get back out of the house a little bit more now, do a little bit more. We're out gardening. We want to be able to we don't want the shoulder to be limiting us. So again, Ramon, you too, we all have Penny, everybody in this chat. Again, you all have the opportunity to sign up for one of these free consultations. And then, again, there's the option of calling the number, or you could also text shoulder and your name. So shoulder, Dr. Pat, to this number, 508-576-5074. You can also call that number as well. So if you look up online, our phone number is 508-528-6100. You could call that, or you could text or call this number here, and I'm going to leave this on the screen. So in a minute or so, I'm going to take some questions. So if you have questions, you can type them into the chat box here. Before I get to that, again, I do hope everybody takes me up on that offer to come in. I'd love to kind of actually see what you guys look like, because I can't really see anybody. And really kind of answer some more questions on a more individual basis and figure out what the best treatment option would look like for you. Again, it's a free consultation. It's done in a private room. We'll go through some more questions on that if you guys have questions as well too. But I'd love to actually be able to see you after you got to, unfortunately, watch me for the last hour. I like to be able to kind of put a face to the names of people that I've been emailing with and talking to. So I highly recommend it. Again, we've been doing this for about 4 years, and people get a lot out of those small appointments there too. So other than that, again, thank you all for coming out to me. Hopefully didn't interrupt anybody's dinner. It's like dinner and a show. But other than that, I'm going to hand it back over to Ashley. She will be able to chime in. I'm going to keep this slide up here, so I won't be able to see the chat box. But Ashley, if you want to tune in and feed me any questions that we had throughout the presentation.
All right, so Ramon asked, in my case, since both shoulders hurt and I cannot sleep on my back, what are my options? He can only sleep on his stomach with his arms down.
So I wouldn't recommend that. I wouldn't recommend sleeping on your stomach with your arms down because what happens, you have to turn your head one way, and a lot of times you can end up with neck discomfort. I would honestly think the best thing to try, Ramon, is to don't go all the way on your side, not on your back, but kind of on your shoulder blade. So almost like you're not flat on your back, you're not 90 degrees on your shoulder, you're kind of 45 degrees, and you can almost put a pillow behind you to kind of prevent yourself from rolling back onto your back if that becomes an issue, or to keep yourself from rolling on back onto the other side. Usually that's a pretty comfortable position, laying kind of at a 45-degree angle. I know that's a tough position to be in. Good thing we got two arms to move around, but if they're both painful, sleeping can be very difficult. The only other option sometimes is if sleeping on your back is difficult, sleeping propped up. Again, we talked about sleeping in the recliner. You could try that. I don't know what they're necessarily called. I always call them like those college pillows that have the high back and they kind of like the armrests that kind of wrap around you. You can kind of, if you get one of those and kind of, that'll sit you up a little bit higher. If any kind of breathing, sleeping on your back becomes an issue, that's another option as well. But the best thing would try to be not on your stomach if you can avoid it, but kind of like a 45-degree angle, not on your shoulder, but more kind of on your shoulder blade at that kind of angle. So I know it's a tough position to be in. I hope that will give you some relief. Try that tonight and let me know how it feels.
All right, so Kathleen has a few questions. We'll start with this one. How are standing desks a good alternative, or?
Yeah, I think, honestly, I think the best, you could have the best ergonomic chair setup And I think if you sat in it all day long, you would still have some problems. I honestly think the best thing to do is change position multiple times a day. If you get one of those adjustable standing desks, you do that for an hour. Just make sure, again, arms are kind of down by the side. You're not reaching out forward. You're not looking down too much. If you can keep keyboard down, out, arms by the side, and your monitor a little bit higher so you can kind of look that way, that's perfect. Do that for an hour, sit for an hour, stand for an hour. Again, sitting all day is not great. Standing all day in one position is not great. But I love those adjustable desks you can move up and down. So yes, I do recommend those. Just make sure you're not standing and looking down at your screen or something like that.
All right, awesome. Penny asked, do you need a doctor's note for physical therapy?
So you do not need a prescription or a doctor's note or anything like that for the free consultation that we offer for this visit. If, of course, a physical therapy or you want to skip to a physical therapist or a physical therapy course, that's more of a question for you, actually. They can either submit it to you. A lot of times it depends. Depends on your insurance. Some you do, some you don't. But for that free consultation, you don't need anything. If you come for that free consultation and we think you would benefit from physical therapy and you think you would benefit from physical therapy, we take care of that communication and that paperwork to send to your doctor. So you do not need anything, no.
Awesome. And if anybody decides to make an appointment, we do check everybody's insurances and we will let you know before you come in if you do need a doctor's note. So I answered this a little bit in the chat, but Sam wants to know if we're doing anything different due to COVID right now.
Yes, I think the entire world as we know it has changed and is now different. I think it goes without saying that staff, patients, everybody is wearing a mask. I think that's kind of a no-brainer. For the free consultations, they're all done in a private room. So what happens is you come in, you have from our sterile bin container, you get a pen and a sheet of paper that we fill out a quick about what's going on with your shoulder and your limitations. And then you're brought into a private treatment room for that 15, 20-minute consultation. You're just alone with yourself and the therapist for that consultation. And then the scheduling will be done after that based on any kind of needs or anything like that. And then in the terms of follow-up visits, if that's something that is you're going to be looking at, yes, we've actually invested in a lot in dividers. So we have dividers between tables, and we're only using every other table. So we've actually purchased more tables, nice big wide tables to keep everybody separated. We moved equipment around, Purell dispensers everywhere, wipes everywhere. And we have somebody kind of full-time that their one job is to just clean. Something's been touched, go clean it. So yes, we've been doing a lot to kind of handle the COVID. And again, we're doing everything that we're doing seems to be working, and we're following kind of all the state kind of guidelines that they've given us.
Awesome. All right. And Kathleen wants to know, is stretching good? Or what stretches to do?
Yeah, so again, yes, stretching is good as long as you're not stretching into too much pain and you're not forcing yourself into that position of impingement. I always say if you feel like you're stretching your arm, a good stretch to do, honestly, is just turn here and climb up a wall. That's one of my favorite stretches to do. But if you feel like something's being jammed and pinched, then I wouldn't do that. If you feel like you're getting a good stretch, then yes, stretching is good. But you have to kind of listen to your body and feel like, yeah, that feels like a good strong stretch, or this really is more pain than it is stretch. Then you probably are going to need some manual therapy to loosen up whatever is restricting you and causing you that pain. And once you loosen that up, then you can go back to continuing to do that wall climb and stretch out that shoulder and use that new mobility that we've gotten you. Anything else?
I think that is it. Ramon just asked if we accept insurances, and we do accept all major health insurances except for Mass Health. If you have any other questions, you can either give us a call or chat us. We
Awesome.
also will be sending an email with the top 3 exercises to do with shoulder and rotator cuff pain, so look out for that as well after the workshop.
All right, thank you, Ashley, and thank you all again for coming and listening to me talk for the last hour. Hopefully you understood my home improvement joke. If not, I'm not very funny anyway. So, but hopefully you've seen the show, so it makes a little bit more sense. Other than that, you're gonna have no idea what that was about. But other than that, again, thank you all for kind of tuning in. I'm just gonna shut off my screen here, but I'll leave this number up if anybody needs to jot it down one more time. But again, thank you all for coming. I really appreciate it, and I hope you all have a great night. Thank you.